Okay, welcome back everybody. I've got a few assignments to go through this week, and this week we primarily were talking about fat. And so I think this is a good image to start it out because I think it showcases almost everything that we've talked about. Okay, so first I'll just look at the guy on the left. This is kind of a student workup, and for the most part it's really pretty accurate. Just a couple things. I mean, I'll go through these over here and you can kind of compare as we go. Well, actually, I'll sit here and just kind of check them off as I go. So temporalis is looking good on both sides, right? We kind of see that. You just notice the temporal line right here, and right here, big plane change, right? That's the temporal line. The other thing that you'll notice, and this is kind of facial expression stuff, which we'll be getting into in week number 5. But notice that the temporal line, there's kind of a termination of this surprise muscle, which we'll talk about, the frontalis, right? He doesn't really bleed over onto the edge, right? He's contained within the forehead by this line. So not only does it give us temporalis on the side, it gives us a boundary to the forehead. Okay, so that looks good. And then you can almost make out, if you look closely, the sunglasses, at least the front of the sunglasses. So zygomatic arch coming through here. And then this kind of the malar prominence sitting right in here. You can pick that out on both sides, right? That's really the thing that we always look for, right? The rest of this is really nice to have and ends up being the widest point on the face, the rest of this zygomatic arch. But this little corner here where the sunglasses turn the corner, that's what we use and modulate with all this fat to make somebody young or old, right? The more this is exposed, the older they are. Okay, so bony structure looks good. Masseter is largely uncovered in here. So right in this area, we can see a lot of masseter. And now the buccal fat that he's indicated here. Remember that this lives deep to the masseter, right? So it's responsible for the general convexity in this area, but it's going back in behind masseter, right? So it's kind of running right alongside your molars and tucking back behind here. So this overlap is a little bit deceptive as it's drawn. So yeah, okay, buccal fat, very good, holding out this this convexity of the cheeks, right? So giving us this overall shape. And now let's look at kind of our big orbital fats, right? So we kind of have kind of our inferior orbital fats right here, and they're showing kind of the distinction between kind of this temporal pad, the nasal pad, which kind of sits in here, and remember it spans all the way up here, right? So that's what whenever we see this, we always look across the tendon to the top and see if we can see evidence of this popping out as well. And usually you can, right? Because it is in fact the same fat pad just lashed down right there. Okay, so that's all looking good. And then remember, right in here, pretarsal fat. This is a really good example of it. It's just kind of hanging out right on the eyelid, the lower eyelid, right? And it's a subcutaneous fat pad. And then up here, we kind of have a pretty good label. This preaponeurotic fat pad, right? So the aponeurosis of the levator muscle. It lifts the eyelid up. This is why it's called preaponeurotic, if you remember, in front of the aponeurosis, which is kind of the tendinous body that grabs onto the lid from the muscle. Okay, and that's to be distinct from roof fat, right? And roof fat kind of lives outside of the orbit. So this is kind of an inside the orbit structure. And then roof fat, if he had, which he probably has a little bit of it, sits kind of in the central and lateral third of the upper margin of the orbit. Okay, so that would be up in here. Now, the next big shape that we see is malar fat, right? And that's going to give us nasolabial furrow, infraorbital furrows, the margins, and the base of the nose, right? So remember, malar fat doesn't go onto the nose, right? It has a nice defined boundary, a nice, well, nice soft edge that where it feathers out and stays off of kind of the nasal bone up here. All right, so don't be deceived. I'll show you a couple images that people submitted of fat pads traced all the way up on the nose, and that's a bad thing to do. Okay, so remember the malar fat pad comes down, and roughly, if you're finding kind of a limit to it, you're looking for kind of the path of zygomatic major, right, from here to the corner of the mouth, and that roughly gives you the limit of the malar fat. Okay, obviously this is just a compartment in subcutaneous fat world, right? But these end up being the common boundaries of that fat pad. Okay, now let's look at the jowl fat, and actually it's the jowl fat here where he makes a little bit of a mistake. He has the superior jowl and the labial jowl right next to each other, front to back, but in fact this is the superior mandibular jowl on both sides. All right, this is exactly where you see a nice hard chin, nice decent edge of the kind of the master back here, and that's where you expect the droop, right? That's what you always look for. And the labial jowl pretty much comes off what when you're young is the node of the mouth, and almost overlaps a little bit of the superior jowl, right? And so those two forms end up being kind of more or less superimposed on each other. Okay, and then finally down below, inferior jowl is almost a mirror image of this below the chin, and then submental fat tucks in right here. And remember, this stays very central, right? This doesn't veer out here. You do have a nice little pocket, and you'll notice that hopefully in your own observations of people. And finally, just sneaking down out here is going to be some of this this posterior mandibular fat tube, right? Just kind of thickening up the lateral section of the neck here. And he's got that kind of on both sides. Be careful not to mistake masseter for the mandibular fat. But again, they're kind of superimposed, so it's easy to conflate the forms. Okay, so that's it for this one. Let's look at a couple more of these. Okay, here we have a more or less full workup of Harrison Ford, Indiana Jones, and I'll just kind of scan to the right of this image and look at the workup and see how it's done. So first, placement of the skull. Largely okay. I mean, we can see plane change here. Kind of the light is just glancing off here, so that's going to more or less coincide to this line. I think he's probably placed it a little bit lateral. Then we have sunglasses. And as we're placing the orbit itself, remember, this is a nice anchor point to look for, both for placing the eyes or conversely, working backwards for placing the orbit from the surface in, right? So you always look for that, and I would say that ends up being more here, right, to give us the kind of the medial boundary. And then if we're looking over here on how he's done the rest of the orbit, it's looking really kind of wide to me, kind of a really wide rectangle, as opposed to kind of square with soft edges. And that's because if you look at this on the face, right, we know when kind of some of the SUF fat sags or kind of loses volume, you get a really hard edge of the orbit exposed. And that's actually sitting right in here, right? So in fact, if we kind of just tweaked all this together, it would kind of move the orbit in, and in fact, some of these boundaries would squeeze in a little bit, and the difference probably ends up being that half a centimeter of flesh that covers skin, superficial fascia, etc., that covers kind of the zygomatic arch and everything. So the skull gets squeezed in a little bit to make all these things fit what we observe on the surface. Okay, so let's go look at the muscles then. I think muscles look pretty good. Remember, muscles more or less go flush up to the edge of the zygomatic arch and a tiny bit around the corner in front. Not a big deal. In age, when you get old, right, you find people where the actual volume of the masseter is severely reduced, right? In which case, you can see the bottom edge, and this becomes a concavity instead of just, on most people, a neutral plane. Okay, snuck a cheeky orbicularis oculi in there, even though we haven't talked about it yet. I don't think. We've talked about it a little bit, but better is the construction of the tarsal plates and the ligaments. Okay, so while we're on this, before we move to the full treatment, just want to show you guys just one more time where the kind of how the buccal fat pad wedges in here. And literally, it's just going to sit right here as the deepest kind of form filling in this little cavity, right? Masseter to the back of the teeth up into this the sunglasses of the zygomatic bone. Okay, so that's going to be where we place the buccal fat. Okay, and then everything else will lay over top of it, and we have a pretty good representation of all these things. So again, malar fat, boundaries that we're familiar with, Suth fat, just kind of following the limit of orbicularis oculi. So I guess in some ways it's good that orbicularis oculi is in. It actually extends over the orbit though, so he's done it quite a bit too small. Orbicularis oculi would be all the way around like that. And so this part here, where it's over the orbit onto the zygomatic bone, that's where we see the Suth fat kind of with age, right? And that's what we see here, which is great. We can see the superior mandibular jowl, and just right in here, this is the labial jowl, right? Always look for kind of this furrow coming off the node of the mouth, and then just a little deposit there. Okay, before I finish with this image, I just want to say one word about what a lot of people have been saying is roof fat, right? When you get old, just like the Suth fat sometimes disappears, the roof fat also disappears. And kind of in the absence of this nice kind of buoyant stuff that makes young, pretty people look pretty, you end up getting just skin folds that roll over the eye, right? In this case, we're seeing skin. I wouldn't identify this hanging over his eyes as roof fat. This is in fact just kind of saggy skin. Maybe there's a tiny bit of roof fat in there, but that's not what's creating this form. This is age and gravity and loss of resilience in the soft tissues. Okay, so just be aware of that. A lot of people made that mistake. People who've submitted kind of images of older faces. Right, they always called that roof fat, but just be aware that it's really a soft skin feature. Okay, classic Winston Churchill here. Let's just have a look at this image. You can see the workup on the right, which actually looks really good. I'll show that to you in a minute. The biggest characteristic when you look at this face, right, we can kind of pick out, hopefully, a lot of these features, right? So if I point back here, right, anything in here you're thinking about, if I point to that area, you're thinking about masseter, right? First thing you think about the back of the jaw, you're thinking about masseter. Then secondarily, you're thinking about fat, right? The posterior kind of mandibular fat roll, and you can actually see, it actually as it's described, right? It is a big roll of fat going back here, right? goes right alongside the border of the ear, and then it tends to diminish a little bit, but sometimes you can see it all the way up into the forehead. But this is kind of the most prominent section. So nice fat there. Regardless, I mean, he's carrying a lot of weight, but still, look at this, right? This is magic, right? Look at this kind of zygomatic bone just prominent here, right? The turn of the corner, right? And then you're just kind of filling in with that. So this is why we study so much of the skull, right? So we can identify this and be able to relate that to the ear, to the eyes, to the limits of the orbit. So all these things are kind of the constructional blocks that you use to make faces. Right, so this is all zygomatic bone, which is great. Now, I'm going to just sneak a tiny bit of masseter in here. Right, there's fat as well, obviously, covering all of this, but masseter will peek in here. See it there, that looks good. The most prominent feature, right, if you look at Winston Churchill, or if you try to remember him just from images that you've seen of him in the past, he's so jowly, right? Not like the jowls that we've seen, the fatty jowls like these, but actually really wide in the mouth, like bulldog type face. And that's to do with this convexity, right? And this is classic kind of buccal fat, right? Contributing to just the volume down here in the kind of in this region, in the buccal region, which is what is actually called the cheek region, right? So that's, again, it's deep, but it's contributing to that push against the surface, right? And so obviously on top of that, you have malar fat. Look at the nice kind of defined boundary here. And in fact, I don't know if you can see closely, but you can almost see a wrinkle right here at the medial boundary with the nose, right? And as we'll learn, there's actually one of our snarl muscles, one of our lip lifters that runs right alongside that that track, which keeps the fat off of there, right? Okay, so that's great. You can see kind of the double jowling down here. Again, this convexity living on top of buccal fat, and then you can see the labial jowl coming off kind of as an extension of the node of the mouth, kind of the modiolus, which is right here. And then down here we can see this form. You can kind of see a separate form in here, and this would be the inferior mandibular jowl. Okay, up here we're seeing kind of a little bit of the nasal fat pad coming out of the orbit. This again is a combination of just what I was saying. This is kind of external to the orbit. You can see how this gives a sensation, the appearance that it wraps around and under this skin, and maybe a little bit of roof fat, just creating this this extra bag over the eyes. Okay, so yeah, I think that's the big look at the fat in this. Let's just see how all this is good done. Nice schematic of anchoring the eyes in the socket. I like that. And then I think, let me just have a quick look around this. So yeah, there's no real hard evidence, I don't think, of SUFAT here, but in fact, we know that you always have SUFAT. It's just whether it's degenerated enough to create unique form. And I don't think it's too noticeable in him, but it's in the right area here. So inferior jowl, so I think there's been a little bit of confusion in the inferior and superior jowl. Superior jowl is this one. Inferior jowl is this one, right? Don't mistake inferior jowl with submental, right? Because submental has its own compartments. And they are side by side, but they're both... it's a little bit hard to pick out a chin line. But if you had the mandible coming through here, you know, it'd be going something like that, right? And so remember this guy up here is suspended by ligament onto the mandible. Okay, I think that is it for Winston, and let's just see what else we have. Okay, Michael Caine. I won't go into this, I won't do the whole thing, but just since we can get a little bit more experience, we can just look at this image and pick out a couple things. Really, this is a textbook case of joweling, right? Especially the superior mandibular jowl. Look at that. I mean, it literally just hangs off. And then you can see the superposition of the labial jowl as well. Right, so two distinct forms. Down here, you don't see a big submandibular fat pad. You can actually make out a little bit of the inferior jowl right here, right, as a separate compartment. But this middle one is pretty empty, right? And so what you're actually seeing instead is a little bit of just skin sag due to like platysma, which we'll see later on in the course. Okay, you can see a little bit of, it's pretty lean up through here, right? We can see a little bit of the zygomatic arch. But as we get down here, notice that there's not a difference in the angle of the jaw, and that's because of the fat pad, right? It's just kind of literally transitioning right over the edge. So that's kind of what we see there. Nice defined limit to the malar fat pad over here with the smile. And just a little evidence of a pretty prominent superior nasal fat pad. Okay, and it looks like all of these things have been resolved here. But again, this was the big thing that I was just mentioning earlier. There's not a huge roof fat pad here. Just look, this is in fact the saggy skin, probably left by the absence of roof fat. Okay. On to the next one. Okay, I wanted to give you guys one look at an image that looks like the malar fat is going onto the nose, right? And that's what we see here. So the guy or girl, I don't have this actually labeled, who's contributed this, but is drawn up onto the nose. And visually, it looks like that's what's happening, but you just have to be very, very careful. Since we know a little bit better, and we'll start to know more, but essentially this guy's not showing much malar fat at all to start with. And so pretty much this whole boundary in here where we would expect malar fat is reasonably empty, and in fact it's almost a little bit concave. But some of the forms that we see coming off the nose are kind of two things. One, we'll learn a little bit later on, is nasalis, which is one of the nose muscles, right? Kind of lashes over the top of your nose and dives down to the maxilla and grabs on there, and it helps to just kind of do funny things with your nose. It goes all the way over the top and comes down the other side as well. So often you'll see a little bit of form coming here just posterior, or just kind of superior and posterior to the nostril wing. Okay, and then up in here you have obviously the nice continuation of the orbital line, right? So the orbit, we can kind of see evidence of it going up through here and up here. And in fact, this boundary of the fat pad here, let me just zoom in. You can see quite clearly where the fat is kind of limited. We can tell that's actually going to be the orbit, right? So that's going to be how that spirals down. It's coming across. And you can see the margin of it there, right? This guy is quite skeletal actually through here. Okay, so all of these things are tiny little surface forms that give us clues as to where to place the orbit, right? And then we can kind of derive eye tendons from that, or vice versa. Okay, let me see, anything else interesting on this guy? This temporal line is really interesting, right? Very shallow in the temporalis, so we can see actually a nice sharp plane change just at the lateral edge of the orbit here. And then obviously continuing up. Again, showing some platysma, right? This is not, shouldn't be marked as submental jowl because there is not much fat there. That's just skin, right? Saggy skin. Likewise, maybe here, I mean, you could, this guy is pretty lean, so you have to maybe see another view to determine whether there's some posterior mandibular jowl there. Okay, I think I have one more image and then we'll be done with the review. Let's see what it looks like. Okay, so here we go. I put this one in. It's last because I absolutely love this face. So classic. Not the most handsome face you'll see, but there's so much character in it. Okay, so really we're not seeing a lot of fat here. And in fact, sometimes a face is characterized as much by the absence of fat as it is by the fat itself, right? And so we have to become very good and very kind of quick, or at least accurate, at kind of assessing the character of a face based on all these variables, right? And so the first variable that we learned about is skull, right? And this is a textbook example of skull, right? And why we learn about it, and the interconnections and the relationships, right? So that you can find these things and place them accurately. Like just gonna sail right over the ear hole. We know that we're going to have the temporomandibular joint right here. It's going to go down. Mandible's going to come up through here. This guy is pretty obviously missing all of his top teeth, right? And probably some of his lower teeth and pulling an expression. That's why we have this plane change. Look at the nose. Look at the transition here. Right, so that's nasal bone and up through the forehead, right? I'm not going to draw the skull all the way in. Likewise, up through here, again, we're not looking at roof fat. So if we have roof fat here, I've got to put a big red X on that, right? Because not much fat there, right? So we know it's there. We don't have to say it if it's not present. The biggest thing that we see here is a really nice representation of orbital fat. And then you can actually make out a really nice kind of malar fat pad as well. And if you look carefully, you can see a pretty convincing boundary at the base of the nose going something like this. You see the anterior border of it there as it kind of overlaps. And then it more or less kind of finishes off like that. Okay, he's not showing much jowling, but maybe just a little softness of the mandible there. I wouldn't put anything else on here really. I mean, we've got masseter in here. Probably some of this fullness in here is a little bit of his parotid gland, right? You see that there's just like extra, almost like a little squished egg sitting there, right? That doesn't look like it belongs as part of the masseter. Now, I don't want people out there, as I say this, to go start sculpting parotid glands on the back of your mandibles on top of your masseters, because I think this is kind of an exceptional case. So I would be very careful too about over describing that, and because it's not a common feature. Okay, and as we kind of fill in all these gaps, right, the big gaping hole that we're left with, if I just kind of hash some of this in. Is the space, right? The big space for buccal fat, or not, as the case is here, right? So a very concave surface because there's no buccal fat between essentially the muzzle, right? All this musculature and tissue of the mouth and the masseter, right? So that in that kind of in that space, we're left with that and the absence of that. So we have a nice concavity to look for there, and then we have a nice concavity to look for up here because we have very, very, very shallow temporalis, right? And so that in collection is kind of the character and the nature of this guy's face, all tied to its anatomical underpinnings, right? And so hopefully if you had to then draw this face or sculpt this face, you would almost have a roadmap, right, based on all these boundaries that we know about. Okay, and that is the whole point of the course. So hopefully this helps, and I will see you now for week 4. Thanks.